Read the roll.
What's going on, Sean?
Mr. Ethier.
Here. Doing. I'll tell you what. I'll
You're
give
gonna
you
give it
$100 for you give me a house for
Simpson are
175.
excused. Drake.
Here.
Grimm.
Here.
Lakakis. Right here. Here, right here. And Ward. Vice President, Mr. Chairman.
You're giving a deposition. Like a Senate
The
hearing.
first item is approving the previous meeting minutes.
Take a
I'll
motion.
make a motion.
Accept the minutes. Anybody opposed, unanimous? Okay.
Items 2 and 3 are tabled at request of sponsor. We're skipping to item 3 is approving the Department of Social Services collective bargaining agreement with CSEA Local 1000, Departments of Social Services, Children, Youth and Families, and Aging Local 801, and amending the 2023 Albany County budget. This item is for Commissioner McLeod.
Go ahead, Commissioner.
Good evening. Yes, so we're looking to get authorization to enter into an MOU, a memorandum with CSEA, Local 801, for Albany County DSS, for our contract from January 1, 2022 through December 31st, 2027, and the attachments for the budget amendment are all included.
The union's in favor of this too?
Pardon me?
Is the union in favor of this? Okay.
Yes.
Thank you. That's the only question I got.
Yes.
Anybody else? Any questions?
I do have a question.
Go ahead.
What's the changes to the dress code?
They gotta wear clothes.
What is it?
It's a couple items, I think it's crossed out in here, what was removed and what was added.
I missed it.
But let's see, it says that tops should not be halter or spaghetti straps.
Yeah.
Our midriffs, and beachwear including flip-flops are not permitted, and clothing should not expose a person inappropriately.
And whose brainstorm
Incredible.
was that? Whose brainstorm was that? Is that, do they all agree to that?
It was the
I said
agreement.
Great.
to that.
Everybody agreed.
Why
to
that
it.
even be a discussion, I'll never know. Go ahead.
It's
All right.
agreed to.
I have a question, Mr.
Yes.
Chair. Are there hair length an issue here? Because that's come up before. Was there any hair length?
We've never had it, no,
An issue,
there's never
okay.
been an issue as far as I
And the
know.
last thing we argued about was the hair, wasn't it? Yeah.
There was a
That was a
hair.
pretty significant debate, wasn't it, Mr. Ward?
I vaguely remember.
Oh, yeah, the CBA.
Remember the hearing thing?
Yeah,
The infamous CBA law.
The crown.
Motion, everybody. We're already joking, Commissioner, nothing to do with it.
I'll make a motion.
Motion, got a second? It's unanimous, Commissioner, you're all set.
It's unanimous, you should maybe ask first.
Anybody opposed, by the way? Those opposed?
Item 4 is approving the Department of Aging collective bargaining agreement with CSEA Local 1000, Departments of Social Services, Children, Youth and Families, and Aging Local 801, and amending the 2023 Albany County budget. Commissioner Ratano is here this evening.
Hi, Commissioner, how you doing?
Hello,
It's nice to see you, you're always smiling.
thank you. I'm here for essentially the same thing, to ask for you to approve the memorandum of understanding with Civil Service Employees Association, Local 1000, and Albany County Department for Aging, and no, I don't care what they wear.
Good for you.
No, I do care what they wear.
Well, you're a different generation.
No, I'm not.
He's not as old as I am, and I don't care what they wear.
Well, I have a question,
I
Mr.
like them
Chair.
to come to work.
That's all you care about, come on.
That's right.
The same dress code.
Mr.
language
Chairman,
is-
maybe
Yes,
Rebecca,
go ahead.
is there any county policy on what employees can wear to work?
You should never ask me that question, because I don't have a slice idea. Ask our lawyer.
I would defer to the Commissioner of HR who's here.
Oh, okay.
Commissioner, we got anything going there? You know
No
any questions?
Anyone got a spotlight?
There is,
It must be in the manual, right?
there's policies specific to the department or job. So it's not universal, it is pertaining to a particular field or department.
All right, so every department decides, and then if it's a union deal, they determine that in the contract.
Agreed, yes.
Okay. That's interesting.
It's more interesting, where's everybody's personal rights, where's all these protesters, well, this nonsense, that's what I'm concerned about.
Let's move on.
Motion?
Yes, take a motion. I make a motion.
Make a motion. Second? All in favor?
Aye.
Anybody opposed? You got it, Commissioner.
Thank you.
Thanks for
Thank
coming.
you.
Item 5 is approving the Department of Children, Youth and Families collective bargaining agreement with CSEA Local 1000, Departments of Social Services, Children, Youth and Families, and Aging Local 801, and amending the 2023 Albany County budget.
Hi, thank you for coming.
This is
Nicole
Ward.
Ward, Deputy Commissioner for the Department for Children, Youth, and Families. The department requested approval of a memorandum of understanding with CSEA. The agreement will commence on January 1st, 2022, and end on December 31st of 2027.
Any questions for the commissioner? No? Take a motion.
Make the motion.
Second.
Second.
Anybody opposed? Unanimous.
Thank you.
Good job.
All right, and back to item 2 is confirming the appointment of the Director of the Department of Residential Health Care Facilities. Mr. McLaughlin's here tonight.
Well, I'm just here for a moment. Members of the committee, this is Mr. Mark Olson. He is our recommendation for the next director of the residential healthcare facility. He has appeared here at your request and is available to answer any of your questions, and yeah.
Yeah.
Thank you.
Do you have an opening statement or anyone?
If you want to introduce myself,
Yeah.
Mark Olson. I'm a lifelong resident of Albany County, with the exception of 1 year, which was my first job in the field of nursing home administration. I lived in Malone, New York for 1 year.
Wow.
My wife is not a fan of that. After a year, I was called back to an organization that I previously did an internship with and worked for them for the next 17 years. I have 4 kids, 2 grandchildren. All grew up in the Latham School District, attended Shaker. My youngest just graduated college, and very proud of my kids. I was very involved in their schooling and in sports. I was president of their PTA and coached basketball for many years. Professionally, I'm a member of the New York State Health Facilities Association, currently the vice chair of the board for that state association with over 400 member nursing homes in the group. Also a member of the American Healthcare Association and on their workforce committee. I do a lot of lobbying in both Albany and in DC. And in 2018, I was recognized as the Administrator of the Year by the American College of Healthcare Administrators in New York State.
Any other questions? Yeah, go ahead.
Thank you, Chairman. A lot of this job, from a fiscal standpoint, is getting reimbursements from Medicaid.
Absolutely.
Larry Slapke was a genius at this. We built an $80 million nursing home, and almost all of it was funded by the state. What is your particular expertise in terms of state reimbursements? Because you have such a myriad of responsibilities as a nursing home director.
Yeah, I mean, I do have expertise in the Medicaid system. I've been involved in lobbying for our state budget issues for many, many years. There are many components that make up the Medicaid reimbursement system for nursing homes. But there's only really a few things that you have some leverage in or some ability to increase or decrease your Medicaid reimbursement. One of those is the case mix, the residents that you have in your facility, making sure that you're maximizing the reimbursement for the care that you're providing. Aside from Medicaid, and Medicare is another huge payment source for the residents of nursing homes, and it's probably the best opportunity to increase revenue by doing some more short-term rehab. Residents who are coming in, getting rehab, going back home. Medicare is a payer of about 2 times what Medicaid pays.
You've got an impressive resume. I'm going to support you, but I'm also this idea of managing costs. We started with $14 million in the red nursing home, and we almost went private. What is your particular expertise in managing these costs that you think warrants your selection today?
Sure. The biggest cost in the budget is labor. It's probably 65-70% of the budget of the nursing home, and managing that labor is, it makes or breaks any budget where I am now, or certainly in this organization. One of the budget killers is agency staff. A lot of nursing homes use agency staff. They cost 2 to 3 times what normal employed staff cost. That is a huge driver in keeping the overall labor budget in check. I've not used any agency staff in my current organization for over 10 years. We're able to continue to recruit, retain staff, and hopefully I can bring some of that knowledge and expertise to this position and work on the budget that way.
Go ahead. Yep.
Thanks.
Welcome. Couple of questions. If we could just expand on Mark Grimm's question. So I know you're just getting into it, but probably this came up in your interview. And as Mark Grimm mentioned, you know, we've been losing money for a long time. We were losing less money now, you know, under Mr. Slatsky's improvements. Do you have a plan to get to a break even or even a in the black position? And if so, how long? And could you talk a little bit about that?
I really haven't gotten into the specific budget. I haven't seen the budget necessarily for the nursing home, but again, it's controlling cost, the biggest cost being labor. We've got to take a really hard look at that, eliminating agency and relying on our own staff, building our own staff. Turnover is a huge cost in an organization that has 300 plus employees. So from a controlling cost standpoint, that would be certainly one of the things that we have to take a really strong look at. And again, I think building on revenue, it's looking for other sources of revenue. In another building I worked in, we created an outpatient rehab program where residents came in for short-term rehab, were able to go home, but then come back to our building and get outpatient rehab services for, you know, with the same staff that they were being treated for within the building. Made a lot of sense, it was great continuity of care, and it brought additional revenue into the building. So I think there's a lot of opportunities like that, other service lines for the senior population.
We're up against, I think, well, I shouldn't say it this way, but fiscally, we're up against new changes by the state in terms of requirements on I think a staffing ratio. Is that correct?
Correct.
And I think we can all agree that that's important to the patients. But from a fiscal standpoint, that's going to add fuel to that fire, it sounds like. You know, do you have any comments on that? I know that's kind of coming, right? That's just taking effect.
Well, you know, the current staffing mandate in New York State is 3.5 hours per resident per day. In my current organization, we're able to meet that. We've met it every quarter. It's been measured. Most nursing homes are not able to meet that. How do we meet it? We cultivate our staff. We ensure that we really work on retention. You know, most organizations have a recruitment and retention committee. I have a retention and recruitment committee. I want to retain the people that we have, develop them, and keep them as part of the organization because turnover is expensive. You lose continuity of care, and that's really important in being able to you know, provide the care and services that the residents need.
You're making the transition from private to public. What motivated you to do that?
I actually started my career in public in Franklin County Nursing Home in 1988. I worked the majority of my career in the private settings. I did work for 2 years in a not-for-profit hospital-based setting down in Catskill, New York. You know, to me, you know, it's really, there's a mission to a county. I give Albany County a tremendous amount of credit for doing what they've done over the last several years to build a new nursing home. Most counties got out of the nursing home business years ago because they were failing, they were a bleed on the county. The commitment that Albany County has made, I think, is phenomenal. I know the building, I drive by it every time I go to the airport. I grew up 3 miles from that building. So it's not so much moving from, you know, from private to public so much. It's the opportunity to go into a new building and continue to develop what you have going here, because I think it's fantastic.
Thank you.
You go ahead, Paul.
Thank you, Mr. Chairman. Hi, welcome here this evening. It's interesting to hear you talk about costs and revenue. One of the big problems we've had, which is we've really turned the corner, was on census. You know, when I started in the legislature here, we were at, you know, 180, 185, dipped down into this 170s, et cetera, and now we're back to 250 with a waiting list, 250 people. That should be a big driver of the intergovernmental transfer funds, because that has to amortize in over a period of years. So I think, you know, taking a look at that and where the revenue projections and how they're going to increase from that point of view in state money is a good thing. I think what you might find challenging is that you work for a private nursing home?
Correct.
Where you had the ability to change salaries like that
We
if you
did.
needed to?
We did.
Well, we have a collective bargaining atmosphere here, and it's not so quick to be responsive, but our prior executive director was very good at working with the county and the union to try to do what could be done to, on the subject of retention. I had a question, and I think we're mostly done with our construction, but have you had experience in terms of building new facilities and, you know, how to maximize the reimbursed value of those facilities? Kind of goes along with what Todd and Mark were asking.
First, census, absolutely, the building has to remain, I mean, that is the revenue source. An empty bed is you get $0 for that. So keeping a census full is incredibly important. How do you do that? You know, word of mouth and reputation is what keeps a nursing home full. People do not want to go to a facility that's failing, that has, you know, negative things that they hear out and about. I hear from our families that they chose where I am now because we're the facility of choice, because they have heard about that from somewhere else. People more and more are doing their own research online about nursing homes and what they're all about. That's very important. Currently, our building right now, it's a 5-star facility from CMS. It's been rated 5 stars since they started the rating system. More and more, that's where people are getting some information as well of where they decide to put their loved one. So census is vitally important to the revenue, to keeping the building full. As far as staffing and salaries, you know, salaries are very important, obviously, to everyone that works in the building, but when you go out and talk to the staff and when I survey staff, that's not always the #1 driver of why people come to the building or why they stay. It's the culture that they work in, it's the environment that they go to work in every day. The money's important, but it's things around that that sometimes are just as important or more important. So you have to have an environment that people will want to go to work in, that they feel welcomed, that they feel that management cares about what they're doing, and that they have their back when changes have to be made.
I have one more question that actually I picked up from the way you answered. We rebranded the place as the Shaker Place Rehabilitation and Nursing Center, obviously recognizing the value of the rehab business.
Sure.
And I think last time I spoke to Larry, like 40 beds were reserved for rehab. If you were to create a satellite rehab program, I mean, we're at our 250 bed limit. Is that something that would be subject to the certificate of need process of the state of New York? So you would say, we want to create, you know, I don't know how you measure that, 10,000 hours of outpatient rehab.
Well, outpatient isn't necessarily subject to certificate of need.
Okay.
If you're looking for, you know, revenue to build a program, that would be. But just creating an outpatient rehab program is still subject to Department of Health approval, but not necessarily a CON. If it was more inpatient beds we're talking about,
Okay.
that would require a CON.
So that would be a much less burdensome
Much less.
regulatory hurdle. And is that something that could be implemented? What kind of range of time?
The biggest challenge, and again, I haven't really assessed the physical plant layout, but there are provisions of what physically has to be in place for an outpatient rehab program. You basically have to have an entrance that, you know, that people could go into the rehab suite to get rehab that doesn't commingle with the residents of the building. Because once a resident is discharged, it comes back, they're the general public at that point. So, you know, those two things have to be kept separate. It can be done in the same space as long as there's a separate entrance, and there's not a lot more beyond that. It's just a matter of getting, submitting paperwork, getting approval, and getting approval from Medicaid and private insurers and others to pay for the service.
Thank you, Mr.
I
Chairman.
got a few more if I could, Mr. Chairman. I often have discussions and disagreements with my colleagues about how important salary is in terms of retention and recruitment. I've done a lot of research 25% of the cases, salary's the principal objective. What they care most about, do I like my boss? Do I get along with my coworkers? Is there opportunity advancement? Is the work I'm doing really valuable? Those are the kinds of things that drive recruitment and retention. So I just wanted to jump up and down when I heard you had you say that.
And again, I always tell my staff, people don't quit their job, they quit their supervisor. So, you know, training supervisors to me is of utmost importance.
Because hiring across this county and every agency is, well, they're paying more somewhere else, and I'm saying, well, some of our managers, need to do a better job of leadership. And this is what you have basically now as a leadership job. So when you talk about retention, I look for statistics, data. So when you say we want to focus on retention, I want to know each year how well we're doing on retention. How are we doing on recruitment? We spend hundreds of thousands of dollars on a digital marketing agency. What data can they give you that says this is how we're helping you do your priorities? Because now the nursing home is about your priorities.
Right. Well, are they involved in employee satisfaction surveys, this marketing company, or just?
Yeah, and also trying to get retention and recruitment, all those things. And now you'll be overseeing that.
You can look at retention and turnover. I think retention is a much better qualifier of how well an organization is doing rather than turnover. In my organization, turnover is high in any nursing home. We're a bit lower than average. But 75% of my staff stay on board. They've been there for more than a year, and several for 20, 30, 40 years. But there's 25% of the positions that turn over, sometimes 2 or 3 times a year. So looking at that kind of turnover isn't really fair. It's really retention, I think, is so much more important than turnover. So what can they provide, relative to how we continue to retain people? Again, it's the information about what is important to the individuals that work there. What are the drivers that make them seem successful? They want to be part of a successful organization. So I think it's along those lines, and really bring into me what the employees have to say, and if they're doing surveys of that type.
I think your professional appearance today matches your resume, and I'm all in. Congratulations, and rely on us, not just to exercise oversight, to be whatever help we can to you, because you've got probably the toughest job in the county.
Thank you very much, I appreciate that.
Thank you, Mr. Chairman.
I got a quick follow-up question. Mark mentioned advancement. And again, I only know superficially some of the woes, labor woes we all face in many industries. I'm from private industry. But I know that, at least anecdotally, CNA level, which are probably the most integral level in the nursing home in terms of importance, right? Are also the lowest paid and probably the highest turnover. Is that relatively accurate?
Yes.
Okay. Do those people in your organization now, or can you speak to this? This is a question I'm asking kind of industry-wide, essentially.
Sure.
Is there a path for advancement for those folks who are doing really, the yeoman's work here, right? I mean, the things that the people don't want to do at home, and that's why they bring their loved one here, right? Let's be honest. So is there some way for those folks to remain engaged? Like, hey, if you're doing a phenomenal job here, this is your next path. Is there something like that?
It's sometimes a difficult path, but I'm glad you asked a question, because that is really one of my passions. In any nursing home, there's a lot of CNAs that have capabilities beyond where they're at, but they can't get to the next step. I have a lot of CNAs that would make great LPNs, but they can't either afford to go to school to become an LPN, or even if they get a student loan to go to school to become an LPN, they can't afford not to work and go to school at the same time. So I've been advocating for a long time for programs from the state to help CNAs get to the next level. And there used to be programs back in the 90s that helped them with transportation and child care expenses, something I'd like to see come back, particularly as we're opening a child care center on site. I think one of the challenges for that is how we pay for it in the future. Maybe it's something along the lines of a co-op program where an employee works 4 days in the nursing home and takes care of the kids for 1 day with their own kid, and maybe that offsets the cost of that program. But CNAs, yeah, it is difficult for them to get advancement. We have other opportunities that we've made in my current organization for them to become unit secretaries, which is a step up from where they are. It increases their professional skills a little bit. But one of the things that New York State can do as a whole is is there is a position called med techs. So 36 other states use med techs, and they basically have CNAs that are certified through New York State, and it's actually a federal certification program, where they provide additional training, and they're able to pass medications to residents. Not, just general medications, not narcotics or anything, but the lion's share of a med pass that currently only an LPN or an RN can do. Many other states are able to use this program. The only reason in New York State we can't right now is because it's really being, it has to go through the New York State Higher Education Committee to make that leap to the medication aids. I know the governor is in support of that. But that would be an excellent path and a career ladder for CNAs. We're always going to need nurses. This wouldn't replace nursing positions currently. It would probably just fill the gap of the LPN positions that we can't fill currently.
But it would give people working in the trenches an opportunity to say, look, I don't have to do this forever. I can stay in this field. I can stay committed to my patients. Albany Med is a teaching hospital, right? Is there such a thing as a teaching nursing home?
In a roundabout way, we in my current organization, we are licensed to teach our nurse aid training program. I think only about a third of the nursing homes in the state have their own certified nurse aid training program. We have them. We employ individuals that want to become a CNA. We teach them in our organization. We get them tested, and they become certified nursing assistants. I don't know of any nursing homes that do any education and training beyond that from a certification level. But that's something that I currently have in my current location. I'm not really sure if Shaker Place has that in place at the moment, but.
Well, it's interesting because, like you mentioned, people in that income bracket are gonna have a real hard time quitting work and going to school, and or if they have a family responsibility to be going to night school, whatever. If you had a teaching role that they could be once a week or something like that, one day a week, working with I don't know what the right word is here, but people qualified to teach LPN responsibilities, and have that program, I could think that might be a tremendous retention tool. I mean, that might come at a limited cost if that LPN teacher is also, in fact, a resident working there as well. Again, thinking along the Albany Med lines. And I know nothing about this industry, so I may be speaking foolishly here, but, I'm just thinking about, from what I hear ear to the ground, that's the most difficult thing is the turnover at our particular facility and others. And that we need a way to encourage people because we're not gonna double their salaries. It's not in the cards. So how do we encourage them to stick with it? And I just hope that, and you seem like a guy with that kind of mindset, and I just want to put that out.
In any nursing home, there's not a line out the door of people waiting to come in and work for us. So it's always tough drawing people in. So we got to keep and cultivate the people that we already have in place. One of the things I've been doing for many years is working with other education programs, and a lot of organizations like Maria College, Capital Region BOCES, they send their students to us for their clinical affiliations. So that works really well. They get their clinical affiliations. They get a taste of what nursing home is all about, because most have not thought about working in a nursing home. They all, in college, they all want to go work for the hospital. So we're able to actually recruit a lot of people from those programs. I have my recruiter on the second day that they're there doing their clinicals, giving them the hard pitch of coming to work for us. So it's got to be a win-win situation. If we're just giving them the experience but we're not getting anything in return, it doesn't work, because it's still a lot on our part to host the clinical side.
Well, thanks very much, and best of luck on all this.
Thank you.
You guys over here satisfied now?
Yeah.
I'd like to make a motion.
Oh, wait.
Can I just say, Chairman, thank you for allowing us to thoroughly vet this. I really appreciate
I'm probably
it.
the only chairman of the Republican who speaks so much. But all kidding aside.
It's a real problem for me.
I'll hold my tongue on that one.
He's Gilda Benevolent, isn't he?
Go with that one, that's a good one.
But all kidding aside, I don't have much to ask. I know very little about the nursing home. I'm sure you're highly qualified. The one thing you sold me on is when Danny talked to Danny, he recruited you. You're from the county. That's always been the biggest bitch forever. I've been here 44 years. And why the county executives have to go outside our county to bring people in our county, when I believe that we have to qualify residents in our county to do these commissioner jobs. I'm not talking about the average worker and stuff. We can go out. I'm talking That's how we passed that law years ago, because of hiring commissioners from outside. It drizzles down, now we can't hire people nowhere. That was the intention. Put that aside, I'd also like to know what salary you guys took. It's the first time I met you, I wouldn't know you from Adam, so I'm asking, I don't know what else to ask, I can't ask them guys. So I'll ask you, what is the salary you're supposed to receive? What is it? Oh, 216? 260. Now, the last time we paid slightly 300, is that bad? 350. Check my memory. He didn't get better. It's terrible. But back then, with all due respect, Mark, it was a big K. 300,000 for this guy. It turned people off, even though he did a great job. It wound up being right. But the workers up there, the feedback I got, the taxpayers out there, we got murdered over it. So that's my only concern, is what the salary is gonna be. I'm sold on your Albany County, and the salary's lower than Larry. And where is he still with us?
For the time being.
How long is the time being? You know when you're gonna take over all your stuff?
I'm slated to start on July 11th.
Is that when Larry's leaving?
He's gonna work with him for a fairly undetermined amount, but I talked to Larry about this.
Till he's cooked.
But he's gonna be gone by fall, I suspect.
Wait a minute. He's coming on Monday. Is that what it is, Monday? A week from Monday.
A week from next Tuesday.
Larry's gonna hang on for how long? Anybody know?
Months?
You guys didn't ask that
As soon as,
question?
as soon as
Why
they
do
do,
you ask
probably
that
Mark
question?
would
I
have something.
talked to him, I didn't think it was determined. I believe he's gonna stay on until Martin is very comfortable
Yeah.
with his surroundings. So, which I think is a good transition in any.
What's great, I'm not saying this, I'm
Especially
talking
in a
about the
position
taxpayers out there flipping the bill.
No,
I have
no,
nothing
I-
with that, I don't care about that.
Totally understand.
They can stay 5 more years, I don't care.
Yeah, no,
I asked the questions I think the taxpayers are gonna ask me and all the
Sure.
constituents I got. That's all.
Yeah.
We all know what the nursing home is about. We all know we're gonna wind up there someday. I'm not that far from there now. So I ain't worried about it.
You better be nice to this guy,
But,
Joe.
also-
I mean, he's got a bed with your name on it.
We don't have any openings right now.
They're taking your name off that reserved
Yeah,
room.
I call you Mark because I'm older than you are.
The majority of the money will be probably reimbursed by Medicaid also.
That's
Well,
correct.
Yeah, Paul.
Mr. Chairman, I trust, Larry is now
Excellent.
working at the other
Excellent.
place,
Yep.
and he's living down there. I am not privy to whatever the transition period is, or how Larry's going to be compensated during that period, but I assume that there's probably some vacation involved and all sorts of things like that. And I think a transition period would be very helpful to have an asset there who has literally built this nursing home from where it was, which was not a good place, to the place it is today,
And we were
which
through
is
them
now
battles before.
5-star.
Close it down, open it up.
Yeah.
I went through all that stuff.
Yeah,
And,
Some time ago, I
I
made a
also
motion.
seconded that motion.
so you made a motion, so can I talk for a minute?
I just
I
want to be
listen to all you
sure.
guys, you don't ask questions, to me, the questions you ask are very nice, but I'm asking questions they ask out there,
Okay.
I think. I'm not opposed
That's
to
the
Larry
reason.
staying on, I don't mean that at all. I'm just concerned how long it's go on. I know what the workers up there are gonna say, the backbiters, everybody gossiping, talking about the salaries, this and that, this guy and that guy. I have no problem, right? I can vote for you right now. You cleared my mind
do
up.
it.
I thought he
Being a
had
county
your
resident.
basketball coach.
Senior league.
Then in his resume mentioned the dining program was enhanced. I thought that would appeal to you, Gil.
It would.
I just say, I'm a fiscal conservative as anybody, but this gentleman is worth 260.
I didn't
because-
say he wasn't worth 260, I'm gonna ask what it
Can't
was.
believe we're having this conversation.
Well, it's taxpayer money, we should be talking
Well, I
about it.
wish you told
If
the
he
money
takes you
was
to dinner,
counted.
can he stay?
He's qualified, not
It'll be
disputing
in
that, the
the
money's the
I have a
issue.
start date of July 11th, and I'm not privy to how much longer Larry's gonna be
Right,
staying.
that's all I'm asking. They're not hard questions. You guys may not like that. I
No,
know
because you
I'm
do get
asking
phone calls.
questions, I'm gonna be asked by the public.
Yes,
That's the ones that count to me,
yeah, yes.
The public knows the call.
all right? There's a lot of people out, 100,000 people in this county. And just don't think because we're doing this, they like that a lot out here. They have a response back to us. You made a motion, didn't you?
I'll second it.
See when women are outnumbered?
We have to vote.
The women are always outnumbered here.
Unless you want.
There's a motion on the floor, how many in
We're gonna
favor?
talk, let's talk.
What's the motion? I didn't hear what you said, you were
I
talking
motion
that.
to approve this request.
Okay, I didn't get the part where you were talking about, you didn't make the motion to me, you made it for them, I didn't hear what you said.
Motion to approve this.
All right, good.
We don't know if I
Second.
like this motion.
Sean, you second it?
I did say,
Hey, welcome to Albany
So
County.
did Todd.
Is anybody opposed to it?
aye,
Aye.
Aye.
Good.
congratulations.
Congratulations.
Congratulations and good
Thank you,
luck.
look forward to working with
He
you.
didn't run
If you
with it.
still
I'm
want
not
to
a
stay.
voting member of
vote.
this committee, but I am away from here.
You mentioned you're working directly under Gil.
Are we done? Motion to adjourn.
Motion to adjourn.
adjourn. Okay, thank you.
Thank you, Mr. Chairman. I